Neurofibromatosis 1. Neurofibromatosis 1 is also known as NF1. It is a complex multisystem human disorder caused by mutation of a gene on chromosome 17 that is responsible for production of a protein called neurofibromin, which can grow anywhere on the body. This disorder is one of the most common genetic disorders and is not limited to any person's race or sex. It's an autosomal dominant disorder, which means that mutation or deletion of one copy of the NF1 gene is sufficient for the development of NF1, even though it varies widely. NF1 was formerly known as von Recklinghausen disease, after the researcher Friedrich Daniel von Recklinghausen, who first documented the genetic disorder. Neurofibromatosis 1 is an age-specific disease. Majority signs are visible after birth or during infancy. Signs and symptoms are high blood pressure, bone abnormalities or changes, optical nerve tumors, Lynch nodules, learning disabilities such as ADHD, sorry, that was a typo, or autism, larger than average head size, freckles in the axillary or inguinal area, cafe latte spots, scoliosis, short stature, childhood leukemia, neurofibromas, and seizures. These are the cafe latte spots. They look like birthmarks. And these are the neurofibromas. The neurofibromas, people have them in their arm, legs, back, anywhere, sometimes even in their face. For my case study, I found two that I found interest in. I'm going to talk about the bottom one. The case study is on an 11-year-old girl named Emma. It was 3 years ago. She fractured her arm. The provider that was examining her saw the cafe latte patches on her. During her exam, they tested her for an NF1. That was when she was diagnosed with it. They also found out at the same time that her father also had the NF1 because he was diagnosed at the same time. Her father was the one that inherited NF1 to Emma. During the time, Emma's parents were worried because Emma was struggling in school. She was not happy. She was having trouble making friends. So they found help with the Neuro Foundation. The Neuro Foundation sent a neurofibromatosis specialist advisor to visit her home and school. That way she could help accommodate Emma. This helped her by having learning accommodations, an occupational therapist, which helped her communicate better with other people, that help her make more friends, which before it was a problem. Emma's parents said that she had trouble making friends before. NF1 is a multi-system genetic disorder that is commonly associated with cutaneous, neurological, or orthopedic manifestations. It is the most frequent of the so-called hemorrhagosis. NF1 is very different from central NF and NF2, as wherein patients demonstrate a relative paucity of cutaneous findings, however, have a higher incidence of meningiomas and acute neuromas. As in NF1, it consists of a lower incidence of central nervous system tumors than NF2. Although complications of NF1 can consist of visual loss secondary to optic nerve gliomas, spinal cord tumors, scoliosis, vascular lesions, and long bone abnormalities. neurofibromatosis is caused by genetic defects that either are passed on by a parent or they occur spontaneously during pregnancy. The specific genes involved depend on the type of neurofibromatosis. NF1 gene is located on chromosome 17. This gene normally produces a protein called neurofibromin, as I stated on the second slide. This protein helps regulate cell growth. The mutated gene causes a loss of neurofibromin, which allows cells to grow uncontrolled. Neurofibromatosis type 1 is diagnosed when an individual meets 2 or more of the following 7 clinical findings: 6 or more of the cafe light spots, which are like the birthmark spots. If you have 6 or more that measure 5 millimeters in the greatest diameter, 2 or more neurofibromas of any type, freckling in the axillary area or in the inguinal area, which is like between your legs, optical glenoma, 2 or more Lynch nodules, specific bone changes or abnormalities, a first degree relative with NF1 as a parent, a sibling, or offspring. Neurofibromas, cafe latte spots, bone abnormalities, ADHD, and autism are ways that NF affect individuals either physically, mentally, or with behavior. There is no cure for the NF1. Individuals with this disorder are instead followed routinely, like every year, by a team of neuro-oncologists. And during this annual exam, they have assessment of the skin, check blood pressure, evaluation of growth and development, and also assessment of learning disabilities, complete eye exam, evaluation of skeletal changes or abnormalities. Treatment, it can be chemotherapy, radiation therapy, or sometimes both for the treatment for cancer tumors. However, they try to avoid the radiation therapy because this can cause a secondary cancer. There's also surgical care for people with this genetic disorder, which involves surgery that helps them remove tumors that cause pain or is causing them loss of function. Normally every cell has 2 copies of genes. We inherit one from our mom and one from our father. In NF1, it follows an autosomal dominant inheritance pattern in which a mutation occurs in only one copy of the gene. In other words, a parent with this mutation may pass along a copy of their normal gene or a copy of the gene with the mutation. An option given for prenatal diagnosis is PGD, which is a medical procedure done in conjunction with in vitro fertilization, also known as IVF. This procedure will allow parents who are carriers of specific genetic disorders, not just NF1, to have children who do not carry mutation. Also, for the fetus, there is a chronic villus sampling, which can also detect NF1. Individuals with NF1 have 50% of passing this disorder on their children, but individuals also can have children born with NF1 when they themselves are not a carrier for this genetic disorder. It's the spontaneous change in the genes during pregnancy that causes this. This is the evolution tree. I really don't know how to explain it. one of the students that taking class with us helped me make it. I asked her for help because I really didn't know. I do know that in F1 it is the gene for my genetic disorder.